Every parent wishes they could keep their child injury-free, but accidents do happen. As a parent, you can be proactive to prevent serious injury. We spoke with registered nurse Amy Waunch at Children's Hospital of Orange County to learn about some helpful tips for injury prevention.
Household injuries are the most common injuries for children under age 3, and they are a huge source of emergency department visits. The best way to prevent injury is constant supervision, but even with constant supervision, injuries occur. And most parents know about safety locks on the cabinets, putting the covers over the outlets, but the single best tip for parents of infants and young toddlers is for the parent to get down on their hands and knees and crawl through the house so that they are seeing the home from the child's perspective.
When it comes to water activities, supervision is vital.
Any activities near water do require constant supervision, and children can drown in as little as 2 inches of water. So that includes toilets, buckets of water, even puddles. But even older children who have been deemed competent swimmers still need to have some supervision. Fences must be around pools in any home that has young children.
Amy Waunch encourages helmet use.
Well, as the weather gets warmer and it's daylight savings and the summer months come, children are outside participating in activities such as riding their bike. And it doesn't matter if the child is just riding around the block or up and down the street, they must wear a helmet. And the best way for a parent to get their child to wear a helmet is for the parent to practice those same safety techniques and wear a helmet themselves. The most common sports injury is overuse injuries that involve the bones, the muscles, the tendons. Children are still growing, and when they get injured during sports, it's very important that they give their body time to heal and they actually rest. We live in a culture where we have superstar athletes that children idolize. So they make it their goal to become that athlete, and they practice 7 days a week. They don't take the time to rest when they're injured because they're afraid that they will fall behind compared to their peers.
Amy Waunch talks about the dangers of poison in various forms.
The problem with poisonous ingestions is much more severe in the toddler age because by nature they put everything in their mouth and they're very curious. For the younger kids, if they are acting different, if your child seems to be more tired than normal, if they're having any trouble swallowing or talking, if they're vomiting for no reason that you can think of, you want to consider the possibility of an unintentional poisoning. But we also have to worry about the older children, and those tend to be intentional ingestions. They will take prescription pills that do not belong to them, and they're not knowledgeable enough about the consequences of taking those pills, whether it be taking their parents' diabetes medication or blood pressure medicine or even pain medicine and mixing it with alcohol or other drugs. It is recommended that every parent have the California Poison Control toll-free number programmed into their cell phone. They are a wonderful resource, and that is the first call that should be made anytime a child has potentially ingested something toxic.